Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Thank you for joining us for this edition of the Dignity Health Yavapai Regional Medical Center Healthy Conversations. Today's conversation is about the Patient Blood Management Program at our hospital. We call it PBM. I'm Dale Black, and for 10 years, I've had the privilege to work closely with hospital leadership and clinical staff to develop, implement, and coordinate the PBM program. Among the many things we do, one of the more important things is educational initiatives in the hospital setting, certainly, but also on occasions like this, where we reach out to you, our members of our community.
My name is Beth Black, and in addition to assisting the program coordinator in the areas that he's just mentioned, I also assist him from time to time in providing patient assistance as the need arises, and manage the data that we collect in connection with the program. Now, by now, you're probably wondering, what is patient blood management? And I've found very often over the years when we participate in health expos in the community that the general perception is many times that we're there to encourage blood donation. But actually, we're the other guys. We're all about keeping your blood in you and keeping it working well.
Patient blood management is defined as the scientific use of safe and effective medical and surgical techniques designed to prevent anemia and decrease bleeding. The goal being to improve patient outcomes, and it works. Now, this requires a team approach throughout the entire hospital, but importantly, it actually includes the medical providers in our entire region. It also requires that we follow the science, which means keeping up with the latest research so that we can effectively manage anemia, optimize coagulation for surgical and interventional procedures, so that, putting it simply, when you're in the hospital for having a surgery, you don't bleed too much and you don't clot too much.
It's also about your surgeon adopting precise and meticulous surgical techniques, employing all available methods of hemostasis or stopping the bleed. Now, rapidly diagnosing and arresting blood loss is key in any situation. And in surgery, capturing and conserving blood loss during surgery, when possible, is also part of this approach. Now, another aspect of blood management that you might appreciate if you've ever been a patient in a hospital is this. One of the first people that you see every morning, if you're awake, was a phlebotomist, the person who comes to take blood out of you. But they have an important job to do. You might say that through the blood that's drawn, the tests that are run, your doctor can kind of check under the hood, and that can help guide treatment decisions in your care. However, if more blood is drawn than is absolutely necessary, especially critically ill patients can actually be made anemic through the testing in the hospital. So what's been called phlebotomy stewardship also plays an important role in keeping your blood in you and keeping it working well. Now, maybe it's time for a little refresher about what's in our blood. As you can see from the diagram, when blood is drawn, if it was sorted in a tube, what you would see is about 55% plasma. Now, that's the liquid part of our blood. It's mostly water, but it also has proteins and hormones, nutritional items that actually help in our clotting process. Now, the next 1% is two other of the formed or structured elements. One is platelets, and these kind of create a fibrin or a mesh that clot that helps the bleeding stop at an injury site. So it works together with those clotting factors in the plasma. And then the other formed element are the white cells. These are the only cells in our blood that actually have a nucleus, so they carry our DNA. And as you probably well know, they're so important in fighting infection, fighting off invaders. But that other 44 to 45% of our blood is the red blood cells. Now, to give you an idea of how many of these little cells we have, a woman has between 4 to 5 million cells per microliter, and there are about 50 microliters in a single drop of blood. So you realize we literally have about 200 million red blood cells in a single drop of blood. Men have just a bit more.
Now, these red cells are a vitally important factor and one of the first things that we mentioned in our discussion today. And it's a fundamental principle of PBM. It's managing anemia. Anemia is a serious concern. It is estimated that about 1 in 4 people on the planet are anemic. What is anemia? Well, first, one of the main reasons we breathe is to bring oxygen into our bodies. Our organs, tissues, like skin, muscles, and bones need oxygen. We need oxygen to live. And that oxygen is delivered to the various parts of the body, but how? Through the blood, you say? Yes, but specifically via the red cells. Now, these little disc-shaped raft-like cells can squeeze, no, they actually must squeeze into the tiniest of capillaries. These discs can actually fold down on themselves in order to squeeze through the microvessels. Why? Well, this is where the rubber meets the road, so to speak. This is the place in these microvessels where the red cell delivers the oxygen to the tissue. But if we're not making enough of these cells, or they are not functioning properly, or if they're being destroyed or lost through bleeding, we will not have an adequate supply of oxygen.
We know that if you were in our audience with us today and we ask for a show of hands of how many of us are concerned about getting enough oxygen in our lungs when we breathe, we'd all raise our hands, right? But if asked how many know what their hemoglobin and hematocrit counts are, we might not get as many hands. Well, why do we want to know about hemoglobin and hematocrit? Hemoglobin is a iron-rich protein molecule, and it binds with the oxygen that enters our lungs, and then they hitch a ride in that hemoglobin in the red cells to be ferried about the body to get oxygen to all those tissue cells, as Dale was describing. They drop off oxygen and pick up carbon dioxide. They're the Ubers inside all of us. So the hemoglobin count reveals the number of protein molecules that are inside the red cells. Now, males have about 14 to 18 grams per deciliter. Females are a little less, with 12 to 16 grams per deciliter. The hematocrit is the percent of any given volume of blood that is taken up by those packed red cells. So these are two important counts, and a good way to remember them is what's been called the rule of 3. So an easy way to remember what might be viewed as the normal range is what's been called that rule of 3. If the volume of red cells, let's say 5 million per microliter, then the hemoglobin is going to be 3 times that, or 15 grams per deciliter. And then the hematocrit would be about 3 times the hemoglobin, or 45%, which is like we saw in that earlier slide with the tube of blood. So essentially, you need enough hemoglobin molecules within a red cell to carry oxygen. But then you need enough of those red cells to properly carry the oxygen to all the cells of your body. And the cells need to be the right size. So I think of it as similar to the relationship between the number of passengers and the number of lifeboats on a cruise ship. And if in an emergency those lifeboats ever needed to be used, you'd want to make sure they were full to capacity. So what do you and I need to do with this information? Well, it's logical that we need to become educated consumers and really partners in our own health care.
So it's clear by now, I'm sure, that we want to avoid anemia, don't we? We want every breath that we take to be one that sustains our life, a breath of life, if you will. So what do? Once a year, see your doctor. Ask him to order a lab workup on your blood. It's called a CBC, or a complete blood count. If the numbers reveal that you're anemic, you should ask your doctor to find out what the underlying cause is. Many times, anemia can be addressed through nutrition and supplements, especially in the case of iron deficiency, which is a lack of usable iron to help create red cells. Now, finding the cause is important because we have questions to ask and answers that we need. Are we making enough red cells? Are we not making enough? Are we losing red cells through bleeding?
It sounds like such a simple thing to do, but you still might be asking, do I really have to add another thing to my health routine? Well, I think of it this way. We go to the dentist as regularly as we can because we realize that tooth decay, cavities, they don't just cause some pain, but they can lead to gum disease, loss of teeth, bone abscesses, and have even been found to potentially have adverse effects in the form of chronic conditions such as heart and lung disease and diabetes. I mean, sometimes it really is the simplest things that are the most important.
For many, we only go into the hospital for a planned surgery or some other procedure. Now, that is a time when patient blood management is especially important, as there will likely be some blood loss in a surgical setting. When we have a planned surgery, then, you can see why making sure that you're not anemic is vital. With your doctor, make sure that you have your hemoglobin and hematocrit counts checked in time to make any corrections prior to a surgery. 2 to 4 weeks prior to the surgery is usually right on.
Now, some strategies that we've listed here that would be important to discuss with your physician prior to surgical procedures could include some dietary and supplement adjustments. There might be treatments prescribed as a result of that blood work, such as taking iron, erythropoietin, vitamin B12, C, folic acid, to boost red cell production if that's found to be necessary. We want to talk to our surgeon about any herbal medications that we take, along with over-the-counter meds such as ibuprofen, because these can affect the body's ability to clot. And you know, many patients today have been prescribed anticoagulant medications such as warfarin or clopidogrel, especially if they have increased risk of stroke. Now, these need to be carefully managed as one approaches a surgical date, because again, you don't want to bleed too much and you don't want to clot too much. So this touches on another fundamental principle of PBM, and that's blood conservation measures and optimizing coagulation. This is particularly important when it comes to the actual surgery. So here we've listed just a few of the key strategies that are utilized to minimize blood loss or conserve blood during surgery. So as you can see, these include collecting blood lost during surgery and returning it to the patient. Now, this process would be used particularly in cardiac and orthopedic surgeries that have a greater potential for larger blood loss. And as an example of how that works, during some cardiac surgeries, a specific amount of blood might be drawn from the patient, contained and actually maintained right there next to the patient while the patient receives some intravenous fluids during surgery. Then that blood is simply reinfused immediately after the surgery is over. Now, why do that? Well, this technique provides the patient with their very own strong, pure blood that's not been altered by that cardiac bypass machine that would have been utilized while the heart was being operated on. Now, back to the slide, we see that fluids called volume expanders are transfused intravenously during surgery to maintain the correct amount of fluid in the blood vessels. There are medications that are used to actually help the body clot at the surgical site, kind of like glues, you might say. There's also, of course, in surgery, no substitute for meticulous surgical techniques that are employed by the surgeon, as well as laparoscopic and robotic surgeries, which actually can also reduce blood loss. Now, surgeons employ devices that might use heat, light, electricity, or vibration to stop bleeding tissue. And also there are products that can be used in surgery that support the body's ability to clot and to reduce bleeding.
In our brief conversation today, we've talked about 3 pillars of patient blood management. Perhaps you missed them. I'll review them quickly. One is blood conservation, making sure you have enough blood in your body. Coagulation, so we don't bleed too much or make clots. And having enough red cell mass so we have oxygen being delivered through our blood appropriately. But the 4th pillar of PBM we have not discussed yet is really you. Please know that with PBM care, you are at the center of decision making. So talk to your doctor and your healthcare team. Don't be shy. Let them know that you want to be treated in a manner that conserves your blood, and that is called patient blood management, or PBM. You could even mention your desire for minimal blood draws during your stay, taking just what's necessary for the testing.
Now here we've listed just a few questions that you might want to discuss with your provider. You'll note that in that first one there's reference to blood transfusion. Now, this of course refers to the practice of replacing lost or non-functioning red blood cells, plasma, platelets, or white cells with those from another human. Now, while this can be life-saving at times, it's not without risk. Our bodies don't like receiving foreign tissue. You imagine that if your doctor told you that you needed an organ transplant, you would realize that's a big deal, and he would be discussing with you the potential for complications and risks, along with the benefits. Well, blood transfusion has been referred to by many physicians as a liquid organ transplant, and it's been found to be much more complicated than it was once thought when it was introduced into modern medicine about 100 or so years ago. So patient blood management strives to recognize that in most cases, you are your own best blood bank, and you have better outcomes when you can avoid the unnecessary transfusion of blood products from another human being, less complications, and shorter stays in the hospital. The program here at Dignity Health, Yavapai Regional Medical Center, is here to support best clinical practice in this area by keeping up with the latest medical research in the field of blood management, and then sharing that knowledge with clinicians in the community, in our hospital, and with you as patients in the community. So we invite you to reach out to us at the hospital with any questions that you might have on your healthcare management in this particular area, how patient blood management can benefit you. You know, today we focused primarily and mentioned quite often iron deficiency anemia, but there are actually other types of anemia, such as anemia that's associated with inflammatory illness or chronic disease. There's pernicious anemia, which is either a lack of or a lack of absorption of vitamin B12. There's microcytic, normocytic, macrocytic anemias, where the red blood cells are either too small or too large, and each of those has their own possible cause. And then last, we think of inherited anemias such as sickle cell and thalassemia. So that kind of really helps emphasize that it's so important for your doctor to determine the underlying cause and the type of anemia that you have so that it can be treated properly. This is a great question. It's so good to see that you realize the importance of having that annual blood workup when you visit your primary care doctor. At this time, Medicare and other insurance providers will not pay for what's called screening blood tests. However, they will pay for diagnostic blood tests. So this really emphasizes how important it is to recognize the signs that you might be anemic and discuss these with your doctor, because then he can order those diagnostic blood tests for you, and they would likely be covered by your insurance. So what are some common signs of anemia? Well, headache, weakness, shortness of breath, chest pain, cold toes and fingers, dizziness, pale skin, restless legs, and then finally some strange cravings like for ice, dirt, and believe it or not, paper. So if you're experiencing any of those symptoms, be sure to share that with your doctor so that proper blood work can be ordered. And of course, you can certainly check with your insurance company prior to having those tests run so that you know that it's covered. It really is worth it. A wonderful source for more information about patient blood management is at YRMC.org. And when you see the tab Medical Services, just scroll down to the Patient Blood Management tab. When you get there, you're going to see all kinds of good things. But one of the tabs on that page is resources. And there we have 5 videos of symposiums that were presented to the community by various doctors, nurses, and other individuals involved with patient blood management. And they address a wide range of topics, such as anemia management, coagulation medications in patient blood management, how patient blood management would affect gastrointestinal, orthopedic, cardiac surgeries, and even the important role of your advanced healthcare directive when it comes to your healthcare.
You can also call us or email us at the addresses and phone numbers shown on the slide. We thank you very much for joining us today for this healthy conversation.